Welcome, everyone. My name is Jo Glaviano. I'm a program manager with Aurora Health Alliance, and you are at the Aurora Health Alliance topical webinar series. And we are excited to talk about accessible healthcare, connection to coverage program overview through Doctors Care. And we are glad you're here.
Good afternoon, everyone. My name is Laura-Elena Porras, and I am the Director of Health Policy and the Coverage Program at Doctors Care. And I'll introduce the clinic itself before I really get into the work that I am presenting on, which is more so looking at health insurance here in the state of Colorado. So to just begin, Doctors Care is a safety net clinic that provides healthcare services to uninsured and underinsured, giving access to affordable medical care regardless of the ability to pay. So we do have other options that are available when it comes to insurance. We've been providing services since 1988, and we provide primary care for patients 0 to 50. Sorry, I did not update that on here, but we accept patients 0 to 50. And we do have a bilingual Spanish team made up of our receptionists, our MAs, providers, and translation services are also available for any other language accommodations. We accept Health First Medicaid, CHP Plus, and for uninsured folks, we offer a sliding fee scale as a self-pay. And then we are now accepting Anthem Blue Cross Blue Shield. And other services that are offered through our clinic, if you are an established patient, are behavioral health and women's health. And so if you would like to schedule an appointment, or if you would like to share the safety net clinic's information, that would be 303-730-1313. And so who we are as part of Doctors Care, we are the connection to coverage team. And so we help folks obtain health insurance, navigate the different health insurance options that are available. And then just really quickly, I think there's people on the chat, but I'm not able to monitor it just because I don't have two screens right now. But
We'll monitor it for you.
Awesome,
Yeah.
thank you.
Yep.
Feel free to stop me at any point if any questions come up. And so our coverage team is a team of certified health coverage guides that provide, again, bilingual Spanish services and support for clients in the South Metro Denver area and the surrounding counties of Arapahoe, Douglas, Jefferson, Elbert, and El Paso counties. Our services are divided between assisting folks with Connect for Health Colorado and Medicaid, CHP, and also the SNAP application, which is for food stamps. Both services are provided all year round, though I'll get more into the caveats of when you should be able to purchase private insurance and Medicaid, all of that good stuff. And just something really cool is that we've been in the game and we've been working with folks with Connect for Health as an enrollment center since 2013. So since the inception of the Affordable Care Act and the application of it here in the state of Colorado. And so I'll dig a little bit deeper into Medicaid first and just how we help folks that way. We are also a certified application assistance site, so a CAS site for Medicaid. And so we are able to help folks with their initial online application. We use the PEAK website to be able to submit an application online rather than doing the physical form. And so Colorado residents can apply for Medicaid CHP all year round. So just be aware of that. There's no limitations of when you can apply, just so long as you're within the income limits. The advantages of using the PEAK website is that most of the time it does result in a real-time eligibility determination, especially if we're completing a renewal or things like that. We're able to get an immediate response of what's going on with the account. And if not, then we can help you navigate whether it's verification documents or things like that that you need to upload in order to move your application further. Then we can help with those processes as well. Not only do we help with the application, but we want to make sure that folks are able to understand really what their Medicaid benefits are. We want to make sure that folks are able to look for physicians, dentists, urgent care, things like that. And so we are able to help folks establish their care so that they actually are able to use their benefits to the fullest potential. Some other key points for understanding Medicaid is that there are income limits and they're based on the gross income for the whole household. So gross income is income before any deductions get taken out of your paycheck. And so that's something really important to note, but there is a little bit of a caveat as well, because if you are self-employed, then we can account for that net income after all of your losses and then, gains and losses have been established for that year, then we can use that income as well. If your income has changed or you've moved out of Colorado since applying for Health First Colorado, it is important to update your information, especially if you're moving out of state, because that way you are able to not transfer, but apply for your services at another state. That's something that's very important. So a lot of people miss doing that, and so it can cause a lot of havoc, especially once you're already in another state. Application renewals are required on a yearly basis, and clients are usually mailed all of that information. Your renewal month aligns with the month that your health coverage, either with Medicaid or CHP, began. So if you apply in July, then in probably May of next year, then you would get a letter saying, hey, you have until July 31st to complete your renewal. And coverage includes medical, behavioral, and dental care. So just be aware of those things. It's a pretty well-rounded coverage program. And so what happens when your Medicaid ends? If you're working through an employer, the first step is to speak with your human resources representative to see what type of coverage is available for you and your family. Now, if you are eligible for coverage, but your family members are not eligible or it's too expensive for them, then that's when you can also contact us, because if you have all been kicked off of Medicaid, that's a special enrollment period for everyone involved. And so we can then navigate other options for those family members who have now had a lapse in coverage. If this is completely unavailable to you, or if you want to assess if it's even affordable based on the Affordable Care Act policies that are set in place, then the next step is to reach out to Doctors Care's coverage team, because we can either reassess that folks qualify for Medicaid or CHP, or we can explore Connect for Health Colorado. The reason that I really want to emphasize that we can reassess Medicaid and CHP is because currently we are, after the pandemic, we were doing a Medicaid unwind, which basically meant that folks who were on Medicaid during the pandemic were being kept on regardless of their income changes, regardless of any changes that were happening that would impact their eligibility. And so now that folks are being kicked off because of income, because of processes, things like that, there could be a chance that you might have just gotten kicked off because you missed your renewal, and that might just mean that we just have to reapply for your benefits, and they just might need verification for more information. So just be aware of those things. It's not just that you completely lost your Medicaid because you're not eligible. Make sure to read through those letters, or again, just contact us and we can make sure we can help you read through them. And so if Medicaid is not an option, then we go into Connect for Health Colorado. Connect for Health Colorado is a private insurance option if, of course, employer-sponsored is not available to you, or if you just can't afford purchasing private insurance on your own. We assist clients with their online application and enrollment through Connect for Health Colorado, and Colorado Connect. Colorado Connect is a subsidiary website that is available, which helps function the Omni Salud program, which allows folks to obtain coverage regardless of their citizenship status. We review available health coverage options to help clients choose the best plan. But I will say we are not a team of brokers. I really want to emphasize that as well, because we are a group of assisters, health coverage guides. And so as health coverage guides, we are certified to educate through the process and help you navigate and filter through the plans, but we cannot make the decision for you. However, we do work with brokers, and we're able to connect you with a broker in your area that is affiliated with Connect for Health Colorado as well, so that you can make a better choice if you don't feel comfortable during the time of your consultation with us. And then we provide health insurance literacy education to help you understand the financial assistance tax credit program and other financial assistance options. And I'll touch a little bit more on those on the next slide. What financial assistance could someone qualify for on Connect for Health? So if you don't qualify for employer sponsored, which is normally, the employer pays probably like 60% of the premium cost, whereas, you don't have that ability if you have decided that you do not qualify for employer sponsored insurance. And so this is something that can cover that cost, and it's like a substitute program for folks who do not have that eligibility. So the advanced premium tax credit is a financial help that lowers the cost of monthly health insurance premium. So this goes towards the monthly cost, the premium of your insurance, not the services themselves. And the eligibility is based on your income and the household size, just like Medicaid. However, the income limits are a little bit different and a little bit higher for certain benefits. And so it's eligible for individuals and families to afford health insurance and make it easier to have that monthly cost. Another benefit that's available, but it's limited to a certain income limit, is cost sharing reductions. So cost sharing reductions lower the cost to help reduce the amount you pay for your health services. So this is helping for those out-of-pocket savings. So they lower costs like deductibles, co-payments, and co-insurance. So the best example I like to give is if you qualify for that cost sharing, if you get that little note once you've completed your application, that cost sharing reductions are available to you. This is only applicable to silver plans. And so just kind of be aware of that, because if you're looking at a bronze plan and it has a really high deductible, if you look at a silver plan, normally they would have, say, a $5,000 deductible or a $4,000 deductible. Some plans with cost sharing reductions that are applied for the family that is financially eligible will lower it up down to almost $100. So it really is a beneficial program for those who qualify. So if you feel, that Medicaid is the only option and you just have to stay uninsured, please contact us, because again, there's other options that you might just not be aware of. And so when can people apply for private insurance? I kind of mentioned that, we do all of this work all year round. And of course, Medicaid, we help all year round without any exceptions. But for private insurance, just like how it works with employer sponsored, there are specific dates when you can apply for private insurance. And so an annual open enrollment period for Connect for Health is that specific period each year to sign up or change your health insurance plan for the upcoming year. It typically runs from November 1st to January 15th. And then your coverage would begin January 1st if you were to apply between November and December 15th. And then if you pass that deadline, then you can still apply between December 16th and January 15th. The only thing there is that if you apply during that second time frame, your coverage will begin February 1st. Now that 15th rule only applies to open enrollment. That does not apply for special enrollment periods. And so if that is missed, you may need to wait until the next annual enrollment period occurs, or you can do something about it once you qualify for a special enrollment period. And I'll talk a little bit more about what those specifics are. A special enrollment period is when a person can enroll in, or they can also change their coverage plan. And it usually happens after certain life change events like moving, having a baby, or losing other coverage. And the important thing to know about a special enrollment period is that it is your responsibility to report this change and to actually do that application or contact, an enrollment center like Doctors Care to help you with that application within those 60 days that that event occurs. And so just kind of be aware of those things, that there is a big time limit, and otherwise there's going to be that lapse in coverage. A little bit deeper into those special enrollment periods, what those qualifying life change events look like. Loss of health coverage is the most common one. Currently with Medicaid, if folks were kicked off of Medicaid and you were kicked off from May of 2024, and I think that's the cutoff. But if you were kicked off in May and before that, then you are actually able to use this special enrollment period until November. So that's kind of nice, because folks have gotten that extended special enrollment period. and sometimes people don't know about that. So if you know someone who might have gotten kicked off for like procedural reasons or what have you, or their income increased, this is something that might be very useful for them to know, is that Medicaid special enrollment period has been extended until November. And so another qualifying life change event that is most common is that change in household, because then again, you're changing that tax household size, so it changes the way that your income works. So marriage, divorce, a new child, that can also be an adoption, and then a death in the family. Change in address. This is a little bit it's specific more so to moving from one state to another, but if you are moving from one new county or zip code, this could also qualify. And then other events can include becoming a US citizen, changes in your income, and changes in your income is for folks specifically who are already clients on the marketplace. And that last one, leaving incarceration, whether that's jail or prison time. And so those are some of the qualifying life change events. But again, I really encourage folks to really connect with us if you really have any questions on like what other life change events might be happening, because they change from year to year. The rules change. Sometimes there's like a big policy change that might impact a lot of people, so they open up a special enrollment period. So definitely keep our information in the back of your pocket. And so I did also want to talk about open enrollment for 2025, because we are gearing up for that here on our team. And so I wanted to give you all an update on some policy changes that are happening with this upcoming open enrollment that I'm very excited about, because we are expanding those coverage options to new populations. So the biggest one here is the DACA eligibility rule. So DACA recipients will become eligible to purchase health plans through Connect for Health Colorado with applicable financial assistance, so they can get APTC, that premium tax credit, or those cost sharing reductions. And they can apply for coverage that is effective 2025, so they can apply during that open enrollment period. But because this change is effective November 1st, people can also enroll in for that month of December 2024. So they actually get at least one extra month if they wanted to. But if folks purchase a 2024 plan, they will still need to enroll in a 2025 plan separately. So it would be two different applications. And so that's kind of the biggest thing, the biggest change for DACA recipients within the private insurance realm. However, I do also want to give another plug for Medicaid and CHP. DACA recipients are now going to be eligible for Medicaid and CHP through the Cover All Coloradans program as well. The Cover All Coloradans program expands coverage to pregnant people and children under the age of 18 within we call them the MAGI, which is the medical assistance gross income, I believe. But that's monthly adjusted gross income. Sorry, y'all. I'm getting all of these acronyms mixed up. But monthly adjusted gross income, which is again that income that I was talking about, that includes the whole household and their gross income, unless it's a self-employed person. And the CHP limits for that program are different, so they are a little bit higher, so just kind of be aware of those things. And so Doctors Care is prepping our team by screening people when scheduling appointments, or they take the walk-ins, so that if they are currently ineligible due to legal status, then we can help them apply for emergency Medicaid. The benefit of applying for emergency Medicaid right now as someone who is a non-citizen and qualifies for the Cover All Coloradans program beginning in January is that we are being told that there's going to be an automatic transfer over to the new program January 1st. So this will allow folks to immediately transfer into the new program that is basically a reflection of the Medicaid CHP benefits. So it's going to be the same program. It's just going to be separate to Medicaid and CHP. So that is the updates, the policy updates that are happening with open enrollment that people should be looking out for. And then of course, the OmniSalud program is continuing. For those that don't know, the OmniSalud program allows undocumented folks to apply for private insurance with without having to provide any social security information. And it's not shared with the federal government as well. So that helps protect our undocumented population while they are looking for health coverage. And depending on their income levels, the first 11,000 folks to apply for OmniSalud are able to apply for, similar to the cost sharing reductions, they're called Silver Enhanced Savings. They cover the premium cost of the plan, and they reduce the out-of-pocket savings, or sorry, the out-of-pocket costs for clients. And so how you can get in contact with us, this is probably going to be the best thing that you will want to take a picture of, is going to be scheduling a free consultation with us. We offer services in office, by phone, or telehealth. Our hours of operation are Monday through Friday, 9:30 a.m. to 4:30 p.m. However, our hours are subject to change, especially during open enrollment. We normally have more extended hours. We will be open on Saturdays, 8 a.m. to 12 p.m. during open enrollment. And that will be only limited to the Saturdays that are not during the holiday weeks. So just be aware of that. And then you can schedule by calling 720-458-6185, or you can schedule your own coverage appointment by visiting our website, doctorscare.org/enroll. And we are located in 609 West Littleton Boulevard, Suite 100, within the clinic itself. And so if you are ever in the neighborhood, just also know that we do offer walk-ins as well. Any questions? I guess I can now look at the chat.
And Laura, this is Rich McLean on the Aurora Health Alliance board. What a terrific explanation. What a terrific overview that you gave. You are a wonderful presenter. I really appreciate it. And I liked how you interpreted the abbreviations and stuff that are out there, because that's important. But I have several questions. I don't want to monopolize it, but let me just ask the first one, and I can leave it open for other people, and I can come back. OmniSalud, the big problem last year, it ran out of slots by the 2nd of November. And that's because people who are already on OmniSalud had to renew. And that's the same thing this year, right?
Yes, that is the same thing this year. The only thing I will say is that they are trying to prioritize those that are renewing, so that they can continue their coverage. And so that is something different that we've had compared to the years past. The enrollment for folks who are renewing is going to be from November 1st to November 22nd. However, if those dates change, I will be sure to send that information to you all. And so those first, I believe that's 3 weeks, are going to be to prioritize those renewals. And so it's not necessarily a renewal where you just press the button and you just go your way. You have to redo the application because it's a different system to the Connect for Health one. And so that is something to be aware of, is that those spaces are essentially already kind of saved for folks who want to renew their plan. And then from then on, they are estimating that there will be approximately 2,000 spots left for the rest of the state. And that's obviously a concern for all of us and very frustrating. But we hope that with this new program with DACA and with Cover All Coloradans, that shifts people over into the new program. And so another thing that we've been doing in preparation is educating folks and making sure that they understand that, OmniSalud might not be the best option for them, even though they think they're scared that, what if this program doesn't become effective, things like that. I would just really encourage folks to inform people like, hey, you're under the age of 18 or you're pregnant, things like that, that just kind of make people more secure about what's going on with the OmniSalud and, Cover All Coloradans, because those are new options that are going to be available. And so hopefully shifting people will allow us to provide that support for OmniSalud as well. Hopefully I didn't ramble too much.
No, but that's really an important point. It's very, very perceptive. People are immediately going to want to get into OmniSalud, but they may well be eligible for the DACA eligibility or Cover All Coloradoans. So, but there's going to be a time of intense anxiousness. So I appreciate you guys standing there at the gates and trying to organize and regulate things. Laura, great. I do have some more questions, but I'll open it up to other folks too.
On that note too, I do see on the chat, Bruce asked if can we schedule or walk in before the rush for a consultation to avoid the rush? Yes, absolutely. We are holding appointments in the months of September and October to help screen folks, especially those that are planning to get on OmniSalud, so that once that shift does happen, we can contact them. And so that's kind of how we're working with them. And then, of course, folks who are able to get on emergency Medicaid, we want to get those folks. We're still doing all of that to get them in. But unfortunately, for folks who are on Connect for Health Colorado, on the Connect for Health Colorado side, they have to wait until November 1st, just because you have to make sure you purchase and all of that good stuff. So it really is more to just kind of help those on the OmniSalud side. But our calendar should be updated with our open enrollment schedule by October. And so you should be able to have those November, December, January dates available for people to book. Any other questions?
Go ahead, Rich.
I will add one thing before you ask your question. I wanted to just mention that I also provide these, like, if anybody else is interested in these health insurance literacy classes within their organizations, I can also offer these for staff members, for, you know, if you have like groups with patients, things like that. I'm more than happy to provide a presentation to prep folks for open enrollment. And I do these all year round as well. And so just be aware of that. I'm gonna go ahead and put my email down in the chat in case anybody wants to connect on that. And then also, if you would like any of our educational materials or marketing materials, I'm more than happy to share that as well. Go ahead with that other question.
Okay. So someone either is attempting to renew their Medicaid, they have dropped it, or they're newcomers into Medicaid. Is it still true that if, for instance, they get Medicaid today, the procedure they had in June, July, or 90 days before would be covered by Medicaid? It's retroactive. Is that still appropriate, Laura?
That is still the case. They do, however, assess if you had, the only way that they'll cover it is if your income was within those limits
Right.
during those 3 months.
Okay. Medicaid can get extremely complicated, especially for people with disabled children and the various complicated waivers. Are you guys equipped for that, or would that be something you would have to refer out when people are asking complicated questions with waivers?
Yeah, when it comes to waivers, one of the best organizations that I will always refer to is Benefits in Action, which is another enrollment center or assistance site for Connect for Health Colorado as well. And they really work a lot better with those waiver programs, because yeah, I wish my team would be able to do those, but unfortunately we're not equipped for all of that. And I believe they might be, Benefits in Action might be a PE site, so they have a little bit of an advantage of being able to do those applications. A presumptive eligibility site, sorry.
Yeah, thank you. I didn't realize Benefits in Action would be so detailed into healthcare matters as that. I'm aware of it, but there's tons of benefits that people are eligible for, and certainly healthcare is one of them. So it's good to know that they would be a good resource, especially for complicated matters. So thank you for that.
Yeah, absolutely.
Patients 0 to 50. So me, I'm older than 50 years old. So I wouldn't be eligible to be a patient, but would I be eligible over 50 years old to sit with you or your team and get help on
Absolutely.
Medicaid? Or
yes, absolutely. Okay. Our services are not, we're not necessarily limited to age. The only thing I will say is we cannot help with Medicare, which is for folks older than 65. However, we do have some brokers. So if we ever get a call of like, hey, we need help with Medicare, we're not going to say, sorry, we can't help you. We'll refer you out to an agent who does Medicare signups and things like that. And so we'll send you over to them, and we've worked with them, and they are actually working also with Connect for Health. And so being able to connect them with Medicare brokers is the best way that we can help folks who are going through that transition. But say you're a mixed household and, your spouse is 65, but you're 60. So then we can still help you. And then, that other person, then we refer them out. So not limited to any specific age. That's the only other thing that we might not be able to do, but no, we are able to work with you if you are over the age of 50.
Oh, great, thank you. Clarified that. The silver plan in Connect for Health.
Yeah.
That it's cost sharing only applies to silver, not to any of the other plans. Is that right?
That is
So-
correct. And that is, and there will be a little bit of changes of how much cost sharing reductions are applied to specific income limits next year, just because the federal government has changed the way that the Affordable Care Act is working, and just with a couple of policies sunrise or coming down from, after the pandemic and all of that, those financial assistance programs are unfortunately decreasing. And so cost sharings, you might see a little bit lower benefits, but that's specific to certain income limits based on the federal poverty levels that we use.
Thank you for clarifying that. Then the advanced premium tax credit, that would apply regardless of whatever plan you get.
Yes, regardless of whatever plan you get, the advanced premium tax credit can be applied to anyone. The only reason I like to explain the cost sharing reductions to folks is because, say you have enough of a tax credit to get a free bronze plan, but now you have to worry about the high deductible, but you also qualify for cost sharing reductions. Yes, you got a free bronze plan, but now you have to cover all of those costs. Whereas if you were to pay for a silver plan and maybe you're paying $30 more a month, then at that point, your services are a lot lower. And that's especially important for folks who have high medical use, a lot of pharmaceutical needs, things like that. So just those are things that we like to discuss with folks when we're working with them.
Wow. So complicated. How is anybody on their own going to make the best decisions for them and their families without guys like you?
It can definitely be very overwhelming. The application itself can be kind of confusing. And so again, we get certified every single year to make sure that we understand the different plans that are available on the marketplace, the different carriers that are available, the networks, all of that good stuff.
Wow. Other questions from folks? Now that I've opened up a few, maybe it stimulated some thought for some more questions for Laura. Well, I have one then, not directly related to this, but maybe you'll know something about it. We're here at the Aurora Health Alliance, working closely, probably closer than just about anybody else, with healthcare policy and financing on their new e-consult platform. Are you familiar with anything about that, Laura? The e-consult mechanisms that Doctors Care has?
No, I would not be.
Okay.
Yeah, no, I would not know about those, but I can definitely, if you are interested, I can connect you with our clinical director as well.
Okay, right. Thank you. That's all I have. I see Nancy has a question, I think.
Yes, I am out in community events, Nancy. That's practically most of the work that I'm doing, usually during the summertime. Between now and October is when I hone in on outreach. And so if there are any vendorships that, might be useful for us to be aware of, or any participation, any free participation would be helpful because we are a nonprofit. But yeah, if there are any community events that you think might be useful for Doctors Care to participate, I am more than happy to connect with all of that. I'll go ahead and, well, my email's in the chat. So yeah, if anything does come up, please reach out.
Yeah, gracias, Laura. I will reach out. There's a lot of really good events that are free resource fairs, just out in the community with schools. That folks come up and they're ready to fill out an application and ready to get something right there. So it would be great to have you too. We have some folks at Colorado Access sometimes attend those events, but I'm starting to see more and more the benefit of having application assistance at every single event. So
Yeah,
thank you.
absolutely. Definitely something we can look into. Yeah, if if we have to meet people where they are, then we do. And so that's always been a priority of ours. We work very closely with organizations here in Littleton to provide on-site services on a routine basis. And so we can definitely work on, doing that for community events, health resource fairs, absolutely.
Hi, this is Stacy. I just have a clarifying question. So when you said those 2,000 spots that might be available through OmniSalute after everyone has renewed, does that mean the financial assistance? Like, I don't really understand what those spots mean, because when I'm looking up online what it is, it says it's a safe option where you can shop and enroll. But then I also see there's the other option, I think, of silver in hand savings, where you can qualify for financial assistance. What does it exactly mean what those 2,000 spots, or what does the person get when they enroll?
Really good question. I'm so glad that you asked that. It's related to the silver enhanced savings. So very similar to how the program works with Connect for Health Colorado. If you qualify for like a full tax credit to pay for your premium costs, you're more than likely going to qualify for the cost sharing reduction. So it's just another name for that program. So the first 11,000 spots offer those cost sharing reductions, and they cover the cost of the premium. So those 2,000 spots would be left for folks who are within those income limits to get the free insurance plan, essentially.
Okay, thank you for explaining that.
Yeah,
And
absolutely. Go ahead.
oh, I'm sorry, I interrupted you. And so, but this platform that allows Coloradans, with no matter what status they have, immigrant status they have, still allows them to look at search for different plans without having to like where they're applying cannot be used for immigration enforcement. Like they still have that option through
Yes,
OmniSalute, just not financial
absolutely.
assistance.
I think you're like the first person to actually be able to identify the difference between the silver enhanced savings for the first 11,000 spots, and then the rest is just, yeah, essentially full price plans. They won't qualify because it's not a tax credit program and they can only cover like the full cost for specific people. That's why they have it set that way, to where they don't want to call it a tax credit because it's not really based on their taxes. And so yes, that's essentially how it works. OmniSalud is the platform, the program that is used to offer this option for folks who are non-citizens to apply without their information being shared with the federal government. Absolutely. And it's a very quick application. It doesn't ask as much questions as the Connect for Health application. It takes like probably 15 minutes, and then the selection of insurance is the next thing that comes up. I will say though, because it is a program that helps pay for the full cost, the rest of the folks from after the 11,000, they do have to pay full price for the plan. So that is the only other difference of it, is that you would pay full price. There wouldn't be like any like, maybe you get $50 or maybe you get this. It doesn't work that way like how it would with Connect for Health.
Thank you. That makes a lot of sense. Thanks.
And then Andrea, I also do see, will existing OmniSalud clients be notified of what they need to do to renew? Yes, I believe Connect for Health is notifying all of those folks about the renewal process. And our clinic specifically is working with our folks that we helped in making sure that we get them renewed first. So, yeah.
So on OmniSalute again, so those folks who aren't already enrolled, can they submit an application on the 1st of November, or do they have to wait 3 weeks?
They're going to have to wait the first 3 weeks, because in order to save those spots for those that are renewing, they want to make sure that all of those folks get in, give them enough time, and then open it up for everybody else. However, okay, so I guess, sorry, let me take a step back. You can fill out the application November 1st. However, you won't be able to like actually apply for the silver enhanced savings if you qualify for them until those 2,000 spots are opened. Does that make sense? So that's why we're kind of doing a screening process where we're like filling out the application for folks, so that come November 22nd, we're just pressing buttons and helping folks out that way.
So there may be 10,000 people wanting to get in, and somehow or other, however fast you press the button, you and the other people on the teams that are submitting it are going to make the difference.
Essentially, yes. And it's a very frustrating program just because I wish there were more funding, and I really wish I could help my whole community. I mean, I'm not the only one, you know what I mean? So it can be very frustrating, and trust me, I share the frustration that most people probably on this call have had with the OmniSalud program because of the cap that it has. And so we're hopeful that, you know, more policy changes are going to continue, and we're going to continue to see that the health insurance world grow in Colorado. Luckily, we're in a state that really cares about healthcare, and hopefully we continue to do more expansion work.
Thank you.
Any other questions from folks? Well, again, I really appreciate everybody's time. Thank you for having me, and thank you for sharing this information also elsewhere. I, again, really just want to emphasize, if you guys know anyone or if you just want to pass along this information, please do, because there's a lot of policy changes that are happening, and we want to make all of those newly eligible folks aware of those changes. So if you could be my partner in that, I would really appreciate it. Again, thank you so much for your time, and feel free to reach out via email if you would like any more information. Thank you.
Thank you so much. Thank you for presenting all that information. It really is helpful and valuable. So thank you. Thanks,
And I
everyone.
really
for
want to
joining.
congratulate or thank Doctors Care for providing the Lauras out there, because it's a resource. That's a huge resource, but it's one that's really needed. And we know Doctors Care from many years ago, and this benefit, this support that you guys are providing in Doctors Care is such a credit to that organization. So thank you, Doctors Care.
I will pass that message along. Thank you so much.
Thanks,
Alrighty.
everyone, for joining.
Bye-bye.